And if you want, you can also measure with a probe, just to make sure that we're at least 3 millimeters from the tissue, which we are. Okay, so I know that the buccal has a little space on it. The mesial and the distal are fully covered by the implant, and the palatal is fully covered by the implant. So now the option whether to graft it or not. So I usually just take a little bit of bone graft, and you can cover up the hole if you want first with a cover screw, but I usually just take it to the buccal and pack it. And then the excess we can section up. And this will also suction up the excess that's in the access hole of the implant. So now we have the implant without any spaces on the buccal. So we have the implant. Okay, and because of how solid it was, we're going to go ahead and place the cover, a healing abutment on. We could also temporize the case, but we're going to place a healing abutment on it, one stage manner. So we'll take the healing abutment, in this case a 3 millimeter healing abutment, and place it in the mouth and check. And we notice that there's a little bit of a gap on the buccal. So what we'll do is we'll start using a more flared healing abutment. Okay, so you can see the difference between the two healing abutment flares. Suction right on top. You want to suction the blood out of the implant, or what will happen is it'll be hard to get the healing abutment or the cover screw off sometimes. Okay, and so because we're 3 millimeters down, the healing abutment should be fairly flushed to the implant, to the tissue, which we are here. And because it's nice and flared, it takes up most of the socket. Okay, because it's nice and flared, it uses up most of the socket, which means that we don't even have to suture. Okay? And the patient can go just like that. Okay, are you okay? So how did it go?
Okay.
Okay, did you even feel anything?
No.
Was it easier than you expected? Besides all the cameras and everything, but was it fairly easy? Okay, so we'll take one more different type of x-ray and then you're done. Okay? No stitches or anything. How's that? You want to take a close-up shot of just the implant? In the mirror, or? There we go. Okay. So notice the healing abutment is just directly in the center. And then the buccal shot. Go ahead and close down, bite down. So you can see how the emergence profile is going to turn pretty much where the bicuspid is and where the molar is, just as such. Okay? Alright.